Hello everyone. So in our patient education series, let's start with the most common cancer in the elderly male. So here we have our in-house oncologist, Dr. Raghavendra Rao. So he is a medical oncologist. Today we'll be discussing about prostate cancer. Let us know what is prostate and what basically prostate cancer is. So let's dive into the session. So Dr. Raghavendra Rao, just please give us a small introduction about the prostate cancer and what exactly is it, and then we'll proceed accordingly.
Thank you, Dr. Keerthana, for the kind introduction. Welcome to all our viewers. So, yes, coming to prostate gland, it is a gland which is important to the male reproductive system, and any abnormal growth resulting in the disorderly growth of cells in the prostate gland is known as prostate cancer.
So, what are the symptoms of prostate cancer? When should people suspect that they are having it? What symptoms they'll be facing? So, can we have a small information about it?
Yes. So, prostate cancer is usually seen in elderly individuals over 50 years of age. So, anyone in this age group who presents with difficulty in passing urine, that is, difficulty in maintaining the stream of urine, or having to go to pass the urine multiple times in a day, more than usual, such people need to be aware about the possibility of prostate cancer. However, every person who has these symptoms do not have prostate cancer. So, selectively, in association with these symptoms and age, they need to undergo screening, and only if there is any suspicion on screening should they be further evaluated for a possibility of prostate cancer.
And what are the tests we do for prostate cancer? So, are there any screening processes, or what are the different types of tests available, and how can the patients be aware of them?
Yes. So, screening basically refers to identification of disease in a person who is asymptomatic. So, we can screen for the presence of prostate cancer in elderly males, and many groups have suggested the particular criteria to identify people for screening of prostate cancer. So, the main guidelines by United States Preventive Service Task Force has recommended any male above 50 years of age presenting with symptoms to undergo PSA testing. So PSA refers to prostate specific antigen, and it is a specific protein which is secreted by the prostate gland, and elevation of this protein can help identify people with prostate cancer even before they can be symptomatic.
It's just a small blood test, so it's a prostate specific antigen, so something which can be used to screen this cancer. So, okay, so and what are the other screening modalities or any tests to confirm the diagnosis of cancer?
In an elderly male with an elevated prostate specific antigen, an ultrasound of the prostate or MRI of the prostate may be done to identify any suspicious lesions. If we do find such lesions on MRI or ultrasound, then we can go ahead with a biopsy to confirm a suspicion of cancer.
Okay. So we know now that elevated PSA is very suspecting of this prostatic cancer. The next step is ultrasound, and then we have the prostate MRI. So exactly now the thing is we have to do the biopsy. So how exactly the biopsy is done, and by whom is the biopsy done?
Yes. So biopsy is usually done by our urologist, and it is done under image guided with the help of ultrasound or MRI, so that a tissue can be taken exactly from the lesion which is representative, and so that we can get the correct diagnosis.
And what are the treatment modalities for prostate cancer? And how do the doctors choose these different modalities of treatment, and how will there be a choice for the patients in selecting the treatment modalities? Can you please explain briefly?
So, coming to treatment of prostate cancer, based on the biopsy results as well as the PSA levels and the clinical condition and the extent of the disease, we categorize the disease into different risk categories, and based on that risk category, we decide the treatment. A patient with very low risk or low risk elderly individual can also be left alone without any treatment, provided that he follows up with regular PSA testing, so that we can, if there is a sudden increase before the patient can become symptomatic, we can intervene. This is known as active surveillance. Similarly, patients with low risk disease to intermediate risk disease, these patients might require treatment so that the symptoms do not progress and there could be relief of symptoms. So, in such patients, there are many treatments available which could include surgery or even radiation therapy. Now, coming to high risk and very high risk categories, as well as those with disease beyond the prostate, that is, the disease has spread beyond the prostate, in such patients, we can go ahead with hormone therapy, some along with targeted therapy, and sometimes even chemotherapy, depending on the extent of the disease. So, these are the different treatment options available, and as per the convenience of the patient and need for treatment, we decide, both the patient and the doctor together decide the treatment to go with.
Okay, and how do the patients be followed up post this treatment? Like, what if the cancer is there a chance for the cancer to reoccur, or how we have to follow up with the patient so that there is a regular follow up and a regular proper monitoring of the disease?
Yeah. So patients who have undergone surgery or radiation therapy to the prostate, we usually follow with the same PSA test. So if suppose the PSA are within normal limits, then we increase the interval of testing from 3 monthly to 6 monthly and later on yearly. If we find that the PSA is increasing, that would be an indication that the disease has come back. And in this situation, we can go for imaging to look for the signs of the disease so that we can start treatment.
Okay, one small information, doctor. So, what are the common side effects of the treatment? Like, for example, there is chemotherapy, there is radiation therapy, there is hormone therapy. Just common side effects or something which we have to be aware about. Can you please explain?
Yeah, sure. So, following hormonal therapy, especially in cases of very high risk disease and metastatic disease, there could be some side effects in the form of fatigue, decreased bone density, which can result to increased risk of fracture. So, these are common side effects that you can sometimes hot flashes are also felt because this hormonal agents they prevent the action of testosterone. So, all the side effects are due to prevention of action of testosterone. Similarly, following surgery, there could be some urinary complications, as well as following radiotherapy, there could be some bowel disturbances in the form of diarrhea soon after radiation therapy, but they usually settle with time by themselves, not requiring any prolonged treatment.
Oh, so very nice to hear about the entire picture. And so, other than the prostate specific antigen, or is there any other screening process, or from what age we need to start screening for the prostate cancer, like from middle aged men, or we can wait till 60 years?
Yeah, so there are clear guidelines regarding the age at which we need to start PSA testing. So that it has been recommended as 50 years and above. So individuals between 50 to 69 years of age and sometimes 74 years of age in areas where life expectancy is longer. So these individuals, even though they are asymptomatic, must undergo a yearly or 2-yearly PSA test. Suppose on yearly testing the PSA has been normal, then we can increase the frequency of testing to 2 years. Suppose if we find that the levels are borderline, then we might prefer to repeat the test at 1-year intervals.
This is a wonderful session. So I think the viewers will get a view about what exactly is prostate cancer and how frequently we have to go for screening, from what age we have to start the screening, and what are the symptoms we may be associated with it. So I hope everyone have understood this. And at the end of the session, I just want to ask you one question. So how is the prognosis of prostatic cancer? Like, is it bad or good, and what is the morbidity or the mortality of this?
Yes. So prostate cancer is by itself an indolent disease. The growth of the disease is slow. Hence, the life expectancy, based on the life expectancy, the survival outcomes are good. Only in a few cases, after multiple lines of treatment, patients might have a aggressive disease, and only in those cases do you find. So they account for only about 5 to 10% of the cases. So in most cases, they do have a normal life expectancy.
Well, thank you, sir. Thank you so much for the very wonderful session on prostate cancer. I hope our viewers will get a better understanding of this disease, and we hope people get screened about it. We hope people know something about it and they're aware about it, so that they can have a better approach if or when this disease happens. Thank you. Thank you so much.